Hello, this is Dr. Leo at LeTime. Milk thistle is a medicinal herb and also known as silymarin. Historically, milk thistle has been used to help to treat liver disorders, and clinical studies, including the double-blinded placebo study, proved the benefits of using milk thistle extract to treat the liver problems, including intoxication, hepatitis, and cirrhosis. In this video, I'll explain the benefits of the milk thistle to the liver problems, which part of the herb to be used, and its side effects. Liver is an essential organ in our body. It has over 500 vital functions has been identified. Liver holds 13% of the blood supply in our body at any moment. Liver regulates most of the chemicals within the blood and clean up the waste and toxins from the bloodstream. One group of the functions of a liver include transforming the toxic ammonia into a urea, and which can be exerted in the urine. Liver cleans the blood of poisonous chemicals such as those from drugs, removing bacteria from blood, and breaking down the harmful substances. Another group of liver functions include the production of cholesterol, regulating the blood clotting, and processing the hemoglobin for use of its iron content. Liver not only provides nutrients, but also clearing the waste and toxins. Protect the liver and keep it working properly is really important to keep our body health. Liver problems can be caused by viruses, alcohol use, and obesity. Damages on the liver can lead to cirrhosis over time, which can cause liver failure, a life-threatening condition. Milk thistle has been used for centuries to help to treat liver problems. And even now is still widely used for the patients who has liver conditions and help to keep the liver healthy. Milk thistle is an annual or biannual plant because it has white veins on its prickly leaves. This brings its milk thistle name. It also called silymarin because within its seeds especially, it contains a large amount of silymarin. Silymarin is a mixture of flavonoids. Silibene is also called silibene. It is a major active compound within silymarin. Silibene is a strong antioxidant. It works very well to scavenging or neutralizing the free radicals, especially those small and powerful ones like a hydroxyl radical. Free radicals are known to causing a lot of healthy problems in our tissue like inflammation or pains. And it is proved that silibene works effectively to reduce the injuries caused by those radicals on some different tissues. Besides, silibene is a good antioxidant. It works well for the anti-inflammation as well. There is an animal study by feeding the baboons with alcohol and comparing a group of feeding with alcohol with silibene. The 3 years study proved the silibene can help reduce the hepatic fibrosis way better than the control group which just having the alcohol. This gives a promising support of silibene may be helpful to reduce the liver fibrosis during the alcohol use. There is another study giving the silibene to the people who has exposure to the toxic solvents, which is hepatotoxic, that means bad for the liver, and they show the silibene can give the benefits of reduce the toxic effect on the liver. That is called intoxication. The last benefits I want to talk about is psilocybin can help reduce the mortality caused by the liver cirrhosis. The results show the mortality decreased by 4% for the overall, and for the liver-only disease caused the mortality reduced by 7%. And these positive results convince us can start trying use the milk thistle to help keep our liver more healthy. There are also many other studies shows not as promising as the others, and it doesn't show the significant improvements by using the milk thistle. So there are more research necessary to keep going, understand what happened, and some of them may caused by the herbs harvest time or the standardized. Some are using the standardized, but some other may not use. So need more information, need a more careful research to understand what happened between these two groups of research. However, on the other side, by using the milk thistle, it's generally safe if taken with appropriate dose. Side effects including diarrhea, constipation, itchiness, and headache. But for those people who has allergy, especially to daisies or marigold, they gotta be very careful. They may have allergy to the milk thistle because they all belong to the same group. Finally, if you want to use a milk thistle, talk with doctor and make a decision if you proceed. Thank you for watching. Please leave comments and questions, and see you next time.